And I am recording this now. Rolling.
Hi, I'm Dustin Wygant. I'm the Executive Director of Integrated Behavioral Health here at EKU. For the last couple of years, our students have been learning CAMS in Dr. Melinda Moore's class and utilizing it in our psychology clinic. And I just think it offers such a tremendous evidence-based approach for managing probably the most challenging clinical situations that our students and really any mental health professional is going to encounter in their careers. What I love about it is it gives them a tool, gives them an approach that they can use in their cases, and really equips them to go on to practicum, to go on to internship, and then to enter their careers as psychologists with this tremendous ability, again, to manage this really challenging clinical encounter. And I've heard nothing but great stories from our students, from our interns, and from our internship and practicum supervisors about how prepared our students are to manage suicidal symptoms in their patients in these settings.
I think that CAMS has made me a much more confident and competent clinician. I believe in my program and in my training here at EKU, I have received the unique experience of getting to work with individuals who are experiencing suicidal ideations and thoughts of suicide. And because of my training in the CAMS treatment modality, I feel much more confident in my abilities to be able to therapeutically work with these individuals.
As an early clinician, I remember the anxiety and fear I experienced working with individuals experiencing suicidal ideation. CAMS has been the intervention that gave me the confidence and skills to stand alongside those individuals and work with them on their path towards life. It's also given me the skills to advocate for those in need in my organization.
My name is Sharon Stallions, and I'm a doctoral student at Eastern Kentucky University, and I am here to talk about how CAMS has affected my clinical practice. I took kind of a non-traditional route to the doctoral program, so I got my master's in 2017 and practiced in the field for about 5 years before I came back. And in my master's program, we did a lot of suicide assessment and a lot of safety planning, but we weren't trained in CAMS, or it wasn't like a CAMS-informed program. So it was a lot of crisis management and a lot of use safety plan and give some DBT crisis skills and then hope the suicidality goes away with therapy. And it didn't teach skills to directly target what is driving the suicidality in that client. So when I got out in the field, I felt like I was always just like in crisis management mode with clients. So we would safety plan and things might get a little bit better for a while with the new skills, but the suicidality, it felt like it always came back around because we weren't directly treating the drivers. So I joked after I learned about CAMS that before it felt like we were just kind of safety planning and praying that things got better. So learning CAMS in this program, I feel like I can more directly target what's actually driving the suicidality and tailor treatment to clients in a way that can actually help them cope in ways that don't include suicidal ideation or suicidal behavior, and also help them mediate the things that are actually driving them feeling suicidal instead of just continuing to play whack-a-mole with crisis symptoms.
Yeah, so what can I say about CAMS and that approach? I mean, I think that it's revolutionary, truly. I've done CAMS with numerous patients in the clinic as well as in inpatient hospitals, and I've seen great results. I mean, I've seen people as old as elderly individuals and as young as children, and all of them had really gravitated toward the collaborative nature of CAMS. I think that that's the ticket, as well as finding those drivers. I just think that's what makes it a great approach and a great treatment.
Hello, my name is Mihaela Seiler. CAMS has been very beneficial to me as a clinician because it has elevated my comfort level in working with at-risk individuals or those that are at elevated risk for suicide. It's also very helpful therapeutically because it helps to identify the drivers of that suicidality, and then for us to be able to adapt individual techniques that can address those drivers independently and hopefully very quickly be able to take down the overall risk of suicide.
Being trained so early on in CAMS in my career really helped me get over those new clinician jitters. It helped me sort through the kind of extraneous details that a lot of my clients would come in with when they had more complex trauma cases, things like that. Because the CAMS therapeutic worksheet and the CAMS worksheets allow me to target in on those drivers, those things that in order to create change in treatment, we need to target those. So the CAMS worksheets really helped me in that, helped me gain confidence as well as building rapport with clients. So I was able to sit down and work on these with them, make them kind of captain of their own treatment. So it was really helpful in that regard.
Hello, I'm Dr. Hogengagel, a graduate from the Eastern Kentucky University PsyD program. When I look back, the primary reason I wanted to go to EKU was its incredible training opportunity for the treatment of suicidality. After going through the program, my confidence and ability to work with high-risk patients is something that's been promoted and commented on throughout my treatment settings. I want to take an opportunity to thank Dr. Jobs for the development of CAMS and the framework that supports it, and your continued support to EKU, which allows trainees to be able to develop the skills necessary to work collaboratively, promoting risk assessment, and talking openly and directly about suicide. The modality that goes along with CAMS is something that I've integrated in my general practice as well. It has strongly influenced my clinical approach as an early career psychologist, and I'm a strong advocate of the continued use in the different clinical teams I've worked on. I just couldn't imagine approaching my treatment methods without the skills and the ability that I've learned through the modality. Thank you, Dr. Jobs, and thank you, Dr. Moore, for the continued integration and support of CAMS at the EKU program.